a vegetarian turning into non-vegetarian. I don't know if you remember or not. I had come with a patient to you who had, I mean, who was vegetarian throughout, and he turned to non-vegetarian, and he had developed hemorrhoids. And you had, typically in your fashion, you had told that, there are some principles which your parents and grandparents are following. Better you also follow, because the Costa and the Agni, all those things will be very similar, and they were following. Grandfather and parents and grandparents were following those rules because of some reason, and we should not break the rules. So that was the advice you had given to the patient. I mean, after that, I had analyzed that it's like Asha or hemorrhoids is like Mamsankura. So Mamsa leading to Mamsa Vruddhi has taken a pathological turn in this case. And also
No,
the reverse also
it's not.
happens.
It is not like that. Usually, see, you observe that how the non-vegetarian diet is prepared. In India, we have some tradition of preparing these non-vegetarian diets where excessive oil or fat content is used. Along with that, lot of spices and mirchi or the masala is used. Whereas Western methodology of cooking meat may be different. There, they may simply boil two different things and they club together and mix it and eat. That may be also there. I have seen some things. But in Indian cooking styles of non-vegetarian, most of the times what they do is the meat will be cooked along with the spices and all those things with a lot of oil and all those things. When this combination of spices, oil and meat may come together, then it becomes a katu ahara and amla or even ushna tikshna ahara it becomes. So when such a ushna tikshna ahara, katu ahara, that type of thing which has been consumed by a patient regularly, then it ends up in katu vipaka. So ahara ends up in katu vipaka. It has an effect on mala as bhadda koshtata. So it leads to Baddha Koshtata, and that Baddha Koshtata leads to Mamsankura development and leads to Arshas formation. That's the reason I ask many of the patients to avoid non-vegetarian diet when they come across these, particularly kidney stones, gallbladder stones, and as well as Arshas, the piles, hemorrhoids.
What about like in the West? It is becoming a big phenomena of where non-vegetarian, people who take mixed type of diet turning into vegetarian. I have seen many cases in which they seem to have lost strength, or lost energy. They will be having. Some of them develop this chronic fatigue syndrome. How to make them cope up to this new diet?
See, it's very simple. The amount of kilocalorie strength what you used to take earlier, that has to be calculated. Then accordingly, the diet whatever we are trying to give in the vegetarian thing, that has to be given based on that. So he should not consume very less diet compared to what earlier he used to take. Then the things will be settled down. Otherwise, what happens is he previously a eater of non-vegetarian eater or a diet he is used to take, and that non-vegetarian diet used to give comparatively extra strength, because we know all those, even Ayurveda Acharyas also very clearly said Kukuto Balyanam. Kukuta used to give me, Kukuta means chicken. Chicken is strength promotive or nutritive. It has been explained even in Ayurveda. Kukuto Balyanam. So when such condition is there, definitely they'll have a such notion. And of course, those who consume the non-vegetarian diet, they'll always feel that only non-vegetarian diet has a strength and vegetarian diet is not having strength. But it is not true. Even elephant doesn't eat any non-vegetarian, but it has a lot of strength. So that should be taken care of. And we always think about, when we talk about the power, we use the term horsepower. So horse is also it's a non-vegetarian, doesn't take non-vegetarian diet. So don't worry about the pattern of diet. You consume the ideal quantity of ahara, the diet which is required for your day-to-day activity, depending upon your requirement. That should be kept in mind.
And probably supplementation with a little bit of like dals and all could also like balance out their regular protein intake also, sir.
Definitely, you can go for some proteins like soya protein, or it may be even the almonds and even milk and even dals. Many type of things are there. You can be handled with that.